at Hôpital Sacré Coeur in Milot, Haiti, with Dr. William Guyol, Jr. of St. Louis. Dr. Guyol is Vice President of the Board of Directors of the CRUDEM Foundation, Chair of the Medical Committee, Volunteer Coordinator, and Internist with full-time practice back in St. Louis. Dr. Guyol, thank you so much for meeting with us, taking time out of your busy schedule, on top of your very professional life as well. And how did you get involved with CRUDEM in Haiti?
I am from St. Louis, where Dr. Dubuque is from. And when I started practice in 1985, Dr. Dubuque was the chief of surgery at the hospital, at St. Mary's Hospital. So from the first, I knew him when he was sick. And then I heard the story of when he got well and he took a leave of absence to go to Haiti. So I've kind of followed the progress of the hospital over the years. And I've known a lot of the physicians who have gone, some of the doctors that I look up to and admire and who have mentored me came here as volunteers. Dr. Donald Bean was the first surgeon, a urologist who accompanied Dr. Dubuque, and I've known a number of the doctors that have gone. So I've always heard stories. And I got involved. I found out my uncle was on the board. He invited me to meet the board of directors when they had a meeting in St. Louis, and so I met the board. I met these amazing people who were passionate, and I made a decision to go.
Very good. So it sounds like Haiti won your heart. Is that what keeps you coming back?
Oh, a lot of things keep me coming back. I think when I first went, and it was a sense of Christian obligation. You know, I'm privileged. I should give something back. But once you get here, you realize it really does capture your heart. You fall in love with the people, most of all. Haitian people are just remarkable. They are graceful, dignified, stoic. You know, there's a lot to be admired. You fall in love with the work. It's just a blessing to be part of this magnificent work. And you kind of fall in love with the atmosphere. It's actually a very interesting, educational trip.
Definitely. In the short time that we've been here, I definitely can see we've kind of fallen in love with it in the past 4 days. Some people are very nice. Yeah.
Right.
So you're here as a medical volunteer and practicing physician. What is a typical day like for you?
Typical day, you get up in the morning, shower, fix a little coffee, go to breakfast at 7. And if you're lucky, it's French toast day. And if you're really lucky, it's crepes day. And Fifi does a great job with breakfast. And then usually head off to the hospital around 8 o'clock. And what I do as an internal medicine doctor, I will usually round in the hospital with the inpatient, with the internal medicine physicians that are covering the inpatients. And then I'll do the internal medicine clinics, which is cardiology, diabetes, hypertension, and then on some days kind of the walk-in clinic where people who come off the streets come in, and you just never know what's going to walk in the door.
So there's no real typical day?
Well, the hours are pretty typical. The clinics go from 8:30 till lunchtime. Sometimes they go till 2, sometimes they're done at 11. Come back, have a little lunch, and then go back in the afternoon and see the rest of the patients, or what happens is the lab has already done the blood work and the x-rays are ready, and you can review the results with patients. Like this afternoon, this morning I was in the diabetes clinic. Well, 2 of my patients have active tuberculosis, got some chest x-rays, they were losing weight, had fevers, sweats, and sure enough they have tuberculosis, so you just never know. So in the afternoon you go over results with people and kind of come up with a game plan. And then you're done mid to late afternoon. 5:30, Sister Ann has set up Eucharistic adoration in the chapel. And you have a little prayer service and communion service, which is just a delightful part of the day. Sit around and visit with your friends, have supper, and the evenings are usually games. We're not big TV watchers, and the TV's broken at the moment anyway, which I kind of like.
Yeah.
So you play games. My preference is zilch, which tonight you're going to learn.
Oh, okay.
You have to. Because Thursday night's the championship.
Oh, no.
And if you don't know the game by Thursday, you won't have a chance to sign the trophy.
Well, I'm very bad at games anyway. We'll see how that goes. All right, so what are some of the differences between practicing in Haiti and practicing back in the States?
Well, practicing in the States, you're spoiled by the technology. You have wonderful capabilities. So the hospital has a fantastic lab. And other technologies are coming online. I mean, we're training a physician and a technician in echocardiography. We're going to be training ultrasound technicians. We're going to be advancing the training of our radiology technician, and we're going to have digital x-ray before too long. So for Haiti, this place is remarkable.
Yeah.
So the technology gap is a whole lot less than most places. I think the diseases you see are different. The patients are different. In some good ways, some bad ways. The types of diseases you see are mostly related to their living conditions and the poverty and the lack of access to health care.
So, continuing on with that, how would you characterize the attitudes and expectations of your Haitian parents in regards to health care?
They have great respect for the hospital and for the physicians. And they have tremendous self-respect, which you can see. They show up dressed meticulously in their best clothes that are pressed and clean. And they comport themselves with great dignity. The peculiar thing, what I found peculiar initially, is that they are absolutely trusting. If you give them good news, bad news, you try to explain something, they believe what you say, and they trust you because you're a physician, and partly because you're a one. They have implicit trust, and that's been bad. That's kind of nice for a doctor, but you'd like to have kind of an educated consumer, and it's not bad to have patients that are knowledgeable and ask questions, and so that's a big difference.
I can imagine people assume, based on the profound poverty and lack of resources in Haiti, that an American physician has more knowledge and experience than a Haitian physician, and the American doctor is in some way better or superior. What would you say to someone with that assumption?
I think we have much better training. Not their fault. It's just the way it is in this country, the way education is, the way the economics are. So, in fact, I think we are better trained. They have better knowledge of tropical diseases and diseases related to malnutrition, malaria, tuberculosis, typhoid. Generally, they have a lot more experience than we do. I think the lack of technology enables them to use their clinical skills more often, and so they should be better at it. As far as that goes, the basic history and physical examination. I've had some Haitian physicians who were phenomenal. There are a couple internists that are good enough. I would have them as partners if they were in the U.S. So there were some exceptional physicians. I think American physicians, if they come in with the attitude that they know it all, they're going to be met with resistance. I mean, our whole purpose is to enable the Haitians to take care of their own. And so our primary goal isn't to provide care. Our primary goal is to educate them and improve the level of health care in Haiti. And if an American physician comes in and says, this is how you're going to do it, this is what you do, this is the best practice, just culturally, it's fairly insensitive, and personally, it's fairly rude, and it's not well met. So establishing relationships, establishing trust goes a long way.
And a few of the Haitian physicians that I've spoken to, they really appreciate having different teams come in and working with them and sharing the knowledge and making them better physicians. And I think that's a really good...
It's a huge deal, and it's what draws a lot of physicians to Sacré Coeur. I mean, we're in a small town. It's not a hot spot. You know, it's not like being in Cap-Haïtien or Port-au-Prince where there are nightclubs and movies and things to do. I think the draw, as far as being able to recruit good physicians and nurses, is the teaching component here. That you get to work with the Americans, find out what the best practices are, and it's actually a very prestigious place to try to get placed.
Yeah. And how does this play out in your role as a physician in the U.S.? What do you bring back to your practice over there?
An appreciation for how easy practice is there, how easily things get done. An appreciation for how stoic and patient the Haitians are compared to Americans. If you had subjected Americans to the kind of suffering the Haitians went through after the earthquake, it just would have been pretty intolerable for the Americans, and if the Haitians are stoic and accepting and full of faith. So it certainly makes me appreciate the Haitians when I go back home. And it makes me appreciate how good we have it in America and how good our patients have it.
So these days everyone seems to want to fix Haiti. In what ways could the present healthcare system in Haiti could be improved?
Improving education. Making sure the next generation of physicians and nurses is better than the last. And that's the best thing that we do here, is educate nurses and doctors. We get through a lot of the problem, but it's best if it's focused on improving the level of care. The technology is wonderful, but teaching is the best thing that we do. So we make a big effort along those lines. We have nursing scholarships. We have our students going to Port-au-Prince now, and we're even considering a nursing school.
Yeah.
And if you do that and you bring nurses up and physicians up and teach them the best way to practice, you'll raise the level of care across here.
So if Hôpital Sacré Coeur were to close tomorrow, how do you think that would affect the town of Milot?
Economically, it would be a disaster. It would, we're the biggest employer. We have hundreds of employees, and there's really not a lot of other opportunities for employment in town, so I think economically it would be a disaster. It would be a great blow to pride in the community, because this institution is a great source of pride. And certainly the healthcare would suffer. People, if you're too far away from a hospital, you die. I mean, things that you and I take advantage, or take for granted. If you get a split in your finger and it gets infected, you're going to find a doctor. You're going to be able to get to a doctor and get some antibiotics. If you have appendicitis and you get to a hospital for a reasonable period of time, you're going to be cured. But no hospital, those are fatal diseases. Have a disastrous effect on the health of the community.
So if somebody watching this video says, I would like to help, what would be the best way for them to go about doing that?
If they're watching this video and they're looking at the website, they need to look at the donate button at the top, because it's a very expensive mission to provide care. And patient income is compared to the cost to do this. And the best thing they can do is support us financially. And making a donation is much more effective than sending clothes or food or whatever. We have a mechanism of getting the money here, getting it to the salaries of the projects that we're doing. So financial support is just huge. And keep us in your prayers, and keep the people in Haiti in your prayers. We've been blessed with wonderful volunteers, and it's just amazing. This place is here after 25 years, and it's only by the grace of God.
Well, thank you very much for taking the time of your busy day to meet with us and tell us more about what you do.
Thank you.